When it comes to birth control, you have options. There are a few questions you might want to think about before choosing. Let's start with the most effective and longest-lasting options. These are above 99% effective because you can't make mistakes. There are two intrauterine devices also known as IUDs. These small T-shaped plastic devices are placed into the uterus by a medical provider and are more than 99% effective. The hormonal options can last between 3 or 8 years, and the copper, non-hormonal IUD lasts up to 12 years. The arm implant is a small rod that is inserted under the skin of your arm and lasts up to 5 years. It's 99.9% effective. Sterilization is a permanent way to prevent pregnancy. There are two main types of sterilization, and both are procedures done to cut off the pathways needed for reproduction. Tubal ligation cuts the fallopian tubes so eggs cannot pass through, or vasectomy cuts the vas deferens so sperm cannot get through. Both methods are above 99% effective, but vasectomies take longer to work after the procedure. This next group of options are dependent on how well you use them consistently and correctly to be the most effective, so they may typically be above 93% effective. The pill is taken every day at the same time and can be less effective if you make mistakes. This is known as typical use. The pill's typical use effectiveness is 93%, but it could be above 99% if used perfectly. The patch is like a little hormonal band-aid that you can place on your upper arm, shoulder, lower back, or hip. It must be switched out weekly. It has the same effectiveness as the pill with 93% effectiveness for typical use. The ring looks like a plastic bracelet, but it works by being placed inside the vagina for 3 weeks. Just like the pill and patch, the ring has a typical effectiveness of 93%. The shot is an injection that works for 3 months and is typically 96% effective. It can be above 99% effective if always used perfectly. These next options need to be used every time you have sex and can be less effective than the other options because of that. They're usually going to range from 71% to above 99% for effectiveness. Pulling out or withdrawal is when the penis is removed prior to ejaculation and requires extreme body awareness and control. The typical effectiveness for pulling out is 80%, but perfectly used it's 96% effective. Spermicides, diaphragms, cervical cap, and sponges are all going to range in effectiveness from the 70s to 80s for typical use. These are used by being placed inside the vagina and work by trying to block sperm. Fertility awareness is tracking your menstrual cycles to determine when you can get pregnant. This type of tracking must be done every day and requires strict self-discipline. There's several things people track, such as cycle lengths, cervical mucus, or basal body temperature. The effectiveness is 77% to 98% and varies based on discipline and whether your body has regular, predictable cycles. Condoms are the only method mentioned so far that also protect you from sexually transmitted infections. While they're great at that, they depend on consistent correct use every time to be 98% effective. Without perfect use, they're usually around 87% effective. There are also internal condoms, which are a latex-free alternative option and effective at 79% for typical use and 95% for perfect use. You can get either from the Condom Concierge for free. These options thus far are for those who are having vaginal intercourse and looking to prevent a pregnancy. Other options include choosing to have other types of sex or no sex, which is 100% effective at preventing pregnancy. Emergency contraception is the after-sex option to prevent pregnancy but is not meant to be used as a regular birth control. This stops pregnancy before it starts, but emergency contraception needs to be taken as soon as possible to work the best and no later than 3 to 5 days after. It is typically 85% to 100% effective. So that's a quick overview of all the options you have for pregnancy prevention, but keep in mind they don't all start working right away. So you'll need to use a backup method like condoms at first, and it may take some time to find the right birth control option for you.